Turning to Sudan and the worsening humanitarian situation there, our humanitarian colleagues are warning that the crisis is deepening as sustained fighting, ongoing displacement, and rising health emergencies continue to fuel humanitarian needs. In North Darfur State, artillery shelling continues to impact residential areas of El Fasher in the Abu Shuk camp for internally displaced people. Local sources report daily civilian casualties, and recent days has seen an intensification of bombardments at night. In South Kordofan State, the International Organization for Migration reported last week that about 2,800 people, primarily women and children, fled renewed fighting in the town of Deepens. They are now scattered across the locality of Al-Khuz in South Kordofan, as well as other localities in neighboring West Kordofan with limited access to a basic protection and services. The situation in the state capital, Kaduguli, has also been very seriously deteriorating in recent weeks, with intense shelling and humanitarian access largely cut off. In northern state, authorities report that about 6,000 people who fled from North Darfur, Khartoum, and West Kordofan due to insecurity arrived in Daba in northern state between the 12th and 22nd of May. Meanwhile, a cholera outbreak in Khartoum state is worsening at an alarming rate, we are told. Our humanitarian partners in the state report an 80% increase in suspected cases over the past 2 weeks, bringing the total number of cases to more than 8,500. The World Health Organization has supported the delivery of medical supplies to some hospitals in Khartoum, but much more is needed to contain the outbreak. In addition, a recent interagency assessment by our partners and ourselves found high rates of acute respiratory infections, of malaria, and of skin conditions among these returnees. The lack of mosquito nets, the lack of proper shelter, the lack of water, the lack of sanitation, and the lack of hygiene facilities is significantly increasing the risk of disease outbreak. With the approach of the rainy season, which typically runs from June to September, we and our partners are racing to pre-position aid. We've established storage facilities with a combined capacity of 30,000 metric tons in Jenaina, in Nyala, and Tawila in Darfur to support the operations in Kordofan and Darfur regions. West and Central Darfur will be served via cross-border operations in Chad. Amidst this, all our humanitarian partners on the ground report that access to education remains severely constrained in North Darfur. Since the conflict began in April 2023, some 250,000 children have lost access to learning. That's 250,000 kids. As of last month, our partners in the state had only reached 14% of children targeted for education support due to insecurity, access challenges, and critical funding shortfalls. Across Sudan, millions of children have been cut off from formal education. We once again call for an increased flexible and timely funding to scale up humanitarian response, as well as unimpeded access via all necessary routes so that aid workers can reach people in need wherever they may be. In Cyprus, Ms. Holgan also meet with other actors. Thank you very much.